Yes, Mr. Speaker, I wanted to comment on the response from Honorable Metito, if you can allow, regarding...
No. We don't want those comments. The honorable member for Funyula, he said he was almost satisfied. He talked about where the fish were breeding, and I think that should be satisfactory. Honorable Eseli. Is something wrong with your mic?
Thank you, Mr. Speaker. I think maybe I fall in the same category like Dr. Nyikal, because I wanted to comment on what Honorable Florence Mutua had given about what is perceived as marginalization of Isiolo. Because I was going to urge the chair to probably do a thorough study of these admissions to universities, because I myself have gone through the same in Bungoma County, started from my constituency to the wider Bungoma County, and actually found that our best performing students are not getting the courses they wanted. They are not getting the top courses, architecture, medicine, pharmacy, dentistry, and so on. So there is a problem indeed, and the chair of education needs to study the matter more closely before we dismiss Jaldesa's query statement offhand. Thank you, Mr. Speaker.
But let's not also turn the chair on a wild goose chase. There must be specifics. If you tell the chair to just go and find out what happens, can you imagine how many students? Yes, please. When they give us specifics so that she's able to go and investigate and come and make an appropriate response. There's another intervention from the Honorable Makali Mulu.
Yeah, thank you, Honorable Speaker. My intervention relates to the questions. And I just wanted to seek your guidance, Honorable Speaker, because when the last session expired, a number of questions actually expired in the session. And I remember I had a question on monitoring and evaluation policy, which was question number 5 of this current session. And as you have said, up to now, I've not even been consulted, but I would just propose, Honorable Speaker, if it would be okay that the chairpersons of committees, once they get the response, they would also give us hard copies and we read and see whether they're convenient for the reason why we ask them. Because at times, we ask these questions just to get a status. And the issue of the monitoring and evaluation policy in this country is a big issue, Honorable Speaker. So I would wish that the new chair of Finance and Planning could just support us and get that response. Thank you, Honorable Speaker.
Indeed, I was just to echo what the Honorable Dr. Makali Mulu has stated. I want to encourage the chairpersons, even when there are requests for statements, even before you come to read the statement here, it is desirable that you reach out to the member who made the request. You can even 1 or 2 days before, if you have the statement, discuss with the member. You may find that the member will give you so much information that you may just come here and say, we have discussed with the member and we have agreed that I go and seek further information. That's a better way, so that the statement that you bring here, which will be tabled here, will, in the first instance, meet the expectations of the member making the request. Don't just keep it to yourself, because you are not the author of the statement. So if you keep it to yourself without discussing with the member, you'll come here, and I'm very glad the Honorable Kato had already said, he had already discussed with the Honorable Oudo. That is the practice we should adopt, chairs particularly. Get the response, even if it's a question, or a request for a statement, call the member who made the request, show them, in fact, give him or her the copy, and discuss with the member. Find out whether it meets their expectations. That way we will reduce a lot of these allegations that I'm thanking the chairperson, but the statement does not meet my expectations. That you could have discussed out there in the streets, or you could go and have a cup of tea and discuss that. we don't want to encourage a situation whereby, because there are no ministers, there are no, the cabinet secretaries are not here. So even when you come and start castigating the chair of a committee, you are really, it's like you're talking to yourself, because you know the member is not, the chairperson is not the author of the statement. But also, on the part of the chairpersons, always adopt it as a practice to reach out to those who ask the questions when you have the answers, and try to see whether the answers, the responses you have gotten, meet the expectations. Honorable Jaldesa said she received a statement at 1:35 or something like that, but at least the Honorable Florence Mutua, the chairperson, and reached out to you to give you a copy of the statement. That is, we should encourage that, because it helps us to also, allow the chairpersons more time to even further interrogate the various functionaries to whom questions or requests for statements may be made. So they say, kazi kwenu, wenye viti. I see there's another, there are too many interventions. The member for Royal Suburbs. Many of you may not know that the constituency called Roysambu is a Royal Suburb. Like the Honorable Ole Sankok didn't know. I can see even Honorable Chris Wamalo is surprised.
Thank you, Mr. Speaker. It is true that name arose from the settlement by the government for the soldiers who fought in the First World War. That is where the Europeans were settled by the colonial government. Mr. Speaker, I rise to seek further intervention from you in regard to a report that was laid to this House on the 5th of December, 2019, by the Departmental Committee on LADS. Mr. Speaker, the report was the recommendations and the finding of a petition that had come through your office through Order 225, petition number 62 of 2019. Mr. Speaker, when the report was tabled, that was 7 months ago. It has not been debated to date for adoption. Recently, Mr. Speaker, I wrote to your office requesting how your office can help us to have this report debated as fast as possible, and you directed the committee to act accordingly. Until today, Mr. Speaker, I have not seen any response from that committee. So, Mr. Speaker, I was requesting you as chair of the House Business Committee, my plea for you and for the people of Roysambu, Mr. Speaker, is that this report be prioritized for debate as fast as possible, as it discusses matters of public utilities in Roysambu, Mr. Speaker, a place we can build a secondary school, a TVET, and a market, and also a bus park to solve the rampant congestion, and particularly around this time of COVID-19. Mr. Speaker, among the recommendations that had been made by the committee was that the permanent secretary, the Ministry of RADS, the county government of Nairobi, and the National RAD Commission should move fast to complete the titling process, particularly for the public utilities and to provide titles for the former employees of the late Jacob Samuels. So, Mr. Speaker, I start to plead with your office to intervene so that this report can be brought in as a motion for adoption through debate. That is my plea, Mr. Speaker. I have a copy of that report with me, very voluminous, and I thank the chair for that committee for working almost on 8 sittings to come up with a very prudent report. Thank you, Mr. Speaker.
Honorable Nyamai, do you have any objections to the report being debated? I can see the Honorable Nyamai, although today she is not sitting in the usual place.
Honorable Speaker, I had made a request earlier because I wanted to make a comment on the matter that had been raised by the Honorable Jaldesa, because I'm aware of a student who was invited by the university to take a degree called Financial Engineering after getting an A grade from my constituency. So I think this is a matter that needed to be discussed further. So that is why I had put an intervention. But now that you have given me an opportunity to comment on the matter raised by the member for Isambu, we do not have any objection with regard to this matter being debated on the floor of the House, and we seek also your guidance as regards this matter. Thank you, Honorable Speaker.
Well, then the clerk should place that report of the committee for debate when the House sits next. Honorable Nyamai and Honorable Eseli and Honorable Jaldesa, and I can see several other members. Given that these concerns that you have all raised, I think there may be need for one of you to frame and style a motion to discuss that particular issue. So that I think, rather than go this question, one question, there will be another one. Now, they may not address the issue. I think to be a bit more holistic, I would suggest that many of you sit with the Honorable Florence Mutua, agree on some form of a motion that would address these issues, so that the House can then make informed comments. And from that debate, from the Hansons, I'm sure there will be, the Honorable Eseli will be making his claim, the Honorable Nyamai, the Honorable Jaldesa, and I'm sure several others. When you pick the Hansons, you will have something a bit more holistic, which may tend to address the issue so that even the committee now will be able to make a good follow-up. But I would want to encourage any one of you to come up with a motion which can be prioritized, because I believe it seems to it's a matter of national concern. So any of you, please, Honorable Eseli, Honorable Jaldesa, Honorable Nyamai, I see the member for Nyando was about to also say something. Please, Honorable Wamalo, I saw. I think if you came by way of a motion and a proper resolution, which will be targeted, I think it will be, it may in a way go to address the concerns that you've raised. And I think that kind of motion can even be party sponsored so that it gets priority. That will be my advice for now, because I'm sure everyone would say, I also got a boy or some girl who got here, I don't got this other one, and who, I mean, all those from all these various institutions, schools. And it will be difficult even for the chair of the committee, or even the committee as a whole, to be able to address whenever, if it is that becomes so scattered. So please, any of you are encouraged to do a motion. But think through it so that the resolutions will be implementable There was an intervention from the Honorable Suleika.
Hai, asante sana Bwana Spika kwa nafasi hii. Nikuko nataka kuuliza pale ripoti ya malalamishi ya wafanyekazi wa kampuni ya Kwale International Sugar Company, kwa ufupi inaitwa Kiscol, imefikia wapi? Mheshimiwa Spika, tarehe 27 mwezi wa 8 mwaka 2015 katika bunge lililopita, nilipokuwa mbunge maalum, nilileta malalamishi haya ama petition, na ukaambia kamati ya leba ishughulike na hiyo petition, wakatoa ripoti, alafu tukaenda hiyo ripoti wakaipatia kwenye kamati ya utekelezaji ama implementation, kuhakikisha kuwa yale mambo walioambia kampuni wafanye yanafanywa. Lakini tukaenda kwa kura ya 2017. Bahati nzuri nikarudi kwenye bunge la 12 hili na nikafufua tena ripoti hii, na kamati ya utekelezaji ama implementation ikaanza kuita mikutano ya wahusika hapa Nairobi kuwahoji, na hawakuridhika na majibu hayo, na wakaamua kuenda kaunti ya Kwale tarehe 29 mwezi wa 3 mwaka jana. Sasa ni mwaka mmoja toka kamati ya utekelezaji wafike Kwale kwenda kuangalia hali ya wafanyekazi, na hadi leo bado ripoti haijafika hapa bungeni, licha ya kuwa nimeshafuata viongozi wa kamati hii mara kwa mara kuwaulizia kuhusu hii ripoti. Nimepata pia kuwa nimeambiwa kwa sababu ya ugonjwa wa corona ndo kamati haijaweza kukutana, lakini Mheshimiwa Spika, ni mwaka mmoja kabla ya corona kufika Kenya ndo kamati ilienda Kwale kwenda kuchunguza zaidi, na hadi leo sijapata jibu mwafaka, na nimekuwa na subra sana, lakini leo nimeona huenda pia tukaongeza tena mpaka mwisho ama ikaja bunge lengine. Kwa hivyo naomba unisaidie kwa hili, asante.
Committee on Implementation. And since the chair here, Honorable Olekenta, apparently also due to COVID, the chair is absent. Honorable Suleika, let me advise that you raise that issue again on Tuesday next week. And the chair of Wednesday. The chair of the Committee on Implementation, please be ready to give an answer as to what is happening, because the report had been adopted. Honorable Sankok, what is your intervention?
Honorable Speaker, mine was overtaken by event because I
Very
really
well.
wanted to say about our Posimoru. The clashes that are there have cost 10 lives and 70 other injured, and we are really very pained on those issues. But I have discussed with Honorable Kwenanga is here, and we have discussed in details, and we'll know how to tackle it. Thank you.
Now, honourable members, there are so many requests, and we are just going to deal with the requests, interventions. So we'll never get to business. Honorable Wamalwa.
Thank you, Mr. Speaker. Mr. Speaker, mine has been overtaken, but was pertaining Jaldesa's concern, where she talked of AIDS. You know, an A normally comes from 70% to 90%. And when it comes to placement, we have cluster points, subjects, which I wanted to request you. Every university has its own cluster cutoff. So it is good to request your students, because the cluster of points in University of Nairobi is higher than Chuka University, for instance. So you need to know those differences. They'll help you for them to get placement. I thank you.
Well, that is advisory. Member Vonyatike, what is your intervention?
Thank you, Honorable Speaker. For the last 2 months, there is a question I asked in the House here under the Committee of Interior on issues related to prisons. I was once summoned to appear before the committee, and on arrival, I was told, we sent you a message last night not to come because the ministry was not ready. Now it's 1 month, that ministry is still not ready up to now. Again, last month, before the sitting here, I issued a statement related to Tali College. Up to now, the committee is silent. I've not heard anything about it. And I want again inform the House that...
Did you issue a statement or did you make a request?
I made a request. Thank you, Honorable Speaker, for the correction. And you directed that it should be investigated. An inquiry should be done. So I expected myself and maybe the witnesses, the people I contacted, to be given room to present the evidence we have so that we can support the allegations raised. Up to now, the committee is silent. They have not reached me.
Which committee?
Sports. So I just wanted to conclude by saying that in most cases we lose some questions. I don't know whether it's a design or it's just a calculative move to make some concerns to be irrelevant by the committee chairs, but I don't know. Let me reserve my question there. Thank you, Honorable Speaker.
I said earlier that questions will not be responded to here in the plenary. The request for statement, yes. There is a new chair of a committee on sports, the Honorable Patrick Macau, member for Mavoko. Please, just look for him. He's not very short. I'm sure you'll be able to identify him.
But I can see the able chair of the administration. Why are they quiet about this concern?
I told you about questions. The other one is a request. the one on the question, approach the chair of the committee, agree when it is. It is not going to be responded to here.
But Honorable Speaker, we are supposed to be notified to appear.
Yes, go and discuss with him.
Thank you.
They will tell you when the CA or whoever it is that is coming to respond is going to appear. Let me get the chair of health to make a response.
Thank you, Mr. Speaker. Mr. Speaker, I would like to give a statement from the Departmental Committee on Health regarding the home births and routine immunization for children during the COVID-19 pandemic
How long
period.
is it likely to take?
Max 3 minutes. I'm going to summarize.
Yes, because I expect that
Yes,
you have given
I'll
a
actually
copy.
just go through a
Have
summary.
you shared the statement with the...
Honorable Amaua, I think the clerk had shared, but I'll also take it my personal responsibility to also reach out to her.
Yes. So just go to summaries.
Okay. The statement was sought by Honorable Mary Njoroge Maua, MP constituency, Maragua constituency. And the first issue was on the status of hospital visits, vaccination of children and births by expectant mothers as compared to the same period last year. And the comparative status of skilled delivery was given by the ministry. And the conclusion is from the comparison, there was no decline in skilled deliveries in 2020 compared to 2019 for each corresponding month, including the month since COVID-19 started, that is from March 2020. Another concern was the impact on immunization performance from January to June 2019 and 2020. There is a marginal reduction of absolute number of children reached for immunization services from a monthly average of 107,300 last year to an average of 98,000 children for the period of after onset of the COVID-19. Overall, 606,000 children were vaccinated between January and June 2020 compared to 643,000 children vaccinated during the same period last year. It is expected to decline again moderately in the face of above challenges and vaccine supply issues. The other issue was what measures has the relevant ministry taken to support expectant mothers who hope to give births at home, including access to medical assistance or referral services after births. The ministry has put measures in place to encourage and ensure continued access to skilled deliveries in health centers. The Ministry of Health strongly discourages home deliveries for many, many reasons. And one of them is that Kenya does not have a human resource and reproductive health commodity support system in place to manage home deliveries or handle emergencies that can routinely arise from any birth occurrence, including what may begin as a normal delivery. Number 2 is that home deliveries pose a particular high risk of COVID-19 infection and transmission, as the home environment is not designed for nor suited for the necessary full infection prevention protocols or infection bath waste handling. These are only possible within a health facility setting. And number 3, home deliveries poses grave risk both to the mother and newborn, including death from complications that cannot be attended to in a timely manner and by persons with correct skill. Evidence has shown that skilled delivery, which is synonymous with health facility delivery in Kenya, is a proven intervention of preventing mother and newborn deaths. And the ministry has reached out to all players to facilitate pregnant mothers to access skilled delivery in health facilities, and is continually innovating to use progressive platforms to ensure all women in the nation can reach the nearest health facility safely and as needed during the period of COVID-19 and beyond. The ministry has also executed its constitutional mandate and developed guidelines, and it's continually building capacity across the country to ensure maternal health services are prioritized as essential services that must continue to be provided safely, both to the mother and to the health care. Our mothers are particularly encouraged to enroll for Linda Mama Universal Insurance Program once they establish that they are pregnant, a program that guarantees free access to skilled care during and after birth throughout the country. And this also goes even to the mothers who are now the teenage mothers who have on increase at this time of COVID-19. The status of the routine immunization services countrywide during the COVID-19 pandemic was her other concern, and the question was which immunization services are being provided. Restrictions of movement on people, limits on capacity of vehicles, and restriction of movement out of and into specific areas, and the curfew initially affected the ability of health workers and clients to access health facility, affected the last mile distribution of vaccines and related logistics, and also affected scheduling of shipments and clearance of vaccines and related logistics in the country. However, the restrictions on meetings and the need for social distancing means most planned immunization strengthening activities were put on hold, and most of the activities involving community mobilization, health worker engagement, outreaches, micro-immunization activities were also put on hold, and most of which wouldn't have been done remotely. Reprioritization of government expenditure to support COVID-19 response and emerging issues slightly impacted vaccine financing, affecting the operations. The school-based program, especially related to the recently HPV vaccine, has been greatly impacted due to the closure of schools and restriction of gatherings, and reallocation of staff from immunization services delivery to COVID-19 response has slightly weakened the country immunization capacity. On the steps that the ministry has taken to improve the immunization coverage to the children, recognizing the challenges the coronavirus pandemic poses to the healthcare system and immunization in particular, the country, through the National Vaccines and Immunization Program, has put in place a raft of measures to address these challenges, which include dissemination of policy guidelines to all stakeholders and services providers to facilitate continually of routine immunization amid this COVID-19 pandemic. Any disruption of immunization services, even for short periods, could result in accumulation of susceptible individuals and an increased likelihood of vaccine-preventable diseases outbreak. Such outbreak may result in deaths and an increased burden on the health system that is already strained by the response to the COVID-19. Reviewing the services delivery guideline in line with COVID-19 infections have ensured existing guidelines on COVID-19 infection prevention measures during immunization sessions are adhered to, and also physical crowding in waiting rooms through scheduling staggering of immunization visits in the day, and also to ensure well-ventilated areas and adhere to social distancing protocols to protect the caretakers and children waiting for immunization. This include dedicating separate specific rooms for sick visits away from the well visits and immunization, and making provision for assessment and performance of triage to immunization clients, their caregivers for acute respiratory systems and risk factors for COVID-19 first to minimize chances of exposure. There's also communication, that's early communication clear given to the caregivers on COVID-19 measures and importance of social distancing and the rationale for inclusion of immunization and one of the priority health services during the COVID-19 pandemic. There's also the issue of enumerated cohorts of children who may have missed their vaccines doses and develop an action plan to catch up for vaccination. There's also issue of to observe septic techniques during the immunization sessions and perform hand hygiene with alcohol-based hand rub before and after all patient contact with potentially infectious material. And then there is the use of soap and water if hands are visibly soiled. Mr. Speaker, there is also supported the timely procurement and distribution of all vaccines by the ministry to serve as delivery points to ensure that they run uninterrupted availability of immunization commodities. There is plan for a national accelerated immunization rapid response initiative to reach the missed children and respond to the heightened risk of vaccine preventable disease. And finally, there is closely monitoring of vaccine uptake and stocks and respond appropriately and timely to any emerging issues. I submit, and on the attachment are also the answers for the members that mentioned earlier, Honorable Janet Nagambo Wanyama on the question that they had raised, and Honorable Sangok, he told me I'd be referring to him as nominee 001, and Honorable Safia Sheikh Adan MP. I submit, Mr. Speaker.
Now it looks that in future we'll have everybody, when you get those statements which are that long, take the salient points, subhead, summarize. Where is the member who made the request? No, Mary Joroge wa Maua. Janet Nangabo.